What is the meaning of the somatic and germline?
Somatic
Body cell, germline means such sperm and ovum. Yeah. What is the difference between the taphra of the somatic cells and taphra of the germline cells? What is the difference? Mutations of the somatic cells and mutations of the germline.
germ cells lead mutation
Germ cell will lead mutation to the baby, okay? Somatic, baby tumors and not varasa, not inherited, yeah? So again, one important point, one question maybe in the exam. What is the difference between the somatic and germline mutations? Okay? I give you an example of the exam. Here, somatic and germline.
So what's the difference between?
I will tell you now. Somatic, germline. Somatic means that all of my, just listen. Somatic means that release. Somatic means that the cells of my body are normal, but just one of them have mutation. It is somatic.
One cell.
One part of the cells, have somatic mutations, have types. But germline means there are some mutations in the sperm or ovum which make all of the body cells of the body mutated. For example, I get a mutation from my mother, and all of my body cells are mutated. It is germline or somatic? Thank you. But if just this part have mutation, it is somatic or germline? Thank you. Is somatic mutation inherited?
No, acquired.
Acquired. Somatic mutation, no grasa. Is germline mutation inherited? Yes? Clear? Again, a question. Which of them is worse? Somatic mutation or germline mutation? Germline. Because all of the cells are affected, and it will be inherited to the son or daughter of their family. Clear? So, cancer runs in families known for over 200 years, but no clear-cut pattern of inheritance. Usually, one mutant allele cancer-causing gene is inherited, predisposed person to cancer. Likewise, cancer develops depends on particular mutant allele mutations in other genes and environmental factors. Are all cancers? Just listen to me. Students at the back of the class.
We discussed it about.
Discuss with me. I agree to be discussed with me. Okay? Start with us. My question: Are all cancers are varasa or no? Yes or no? No. Some of them acquired, some of them inherited. Yeah? Clear? What's your idea? Most of the cancers are inherited or acquired. What's your idea in your mind?
I think inherited.
Most of them are acquired, actually, not inherited. Maybe they have some predisposing genes, but most of the cancers are sporadic. But do you know the meaning of the sporadic? Sporadic. What is the meaning of the sporadic? Means, for example, your grandfather have colon cancer, but the other persons and people in your family are not unaffected. It's sporadic, just one case. Clear? Most of the sporadic cancers are because of the somatic mutations. For example, in the colon, cells are growing, dividing without any control. Clear? And it is somatic mutation. Not all of the cells of the body are mutated. Just one part is taphra, and that will make a sporadic cancer. suppressors are dominant or recessive?
Tumor suppressor dominant.
Just think about the benzene and the brake. If you have two brakes and one of them is working well, if the car stops or not.
Yes.
But if you have two benzines, yeah, and one of them will not work well and just push you to push the car, if one of them is have a mutation, would we make a cancer or not? Oncogenes. Again, imagine that there is a car. Okay, there are two benzines. Okay, one of them is working well and the other not working well. It just pushes and the car runs. Yeah, it is oncogene. Is it dominant or recessive? Dominant. Just one problem will make the car pushes and runs fast. Yeah, it is dominant. But we have two brakes. Yeah, one of them is working well and the other not works. Is it run or not? Stop. Yeah, توقف. So the tumor suppressors are recessive. Recessive means that if one of them works well, there isn't any problem. If one brake works well, is there any problem or not? No, so it's recessive. He says, but clear? We have two benzines. One of them works well, the other not works well. The car runs fast. It is dominant. Yeah? We have two brakes. One of them works well and the other not working. The car stops. Okay? So, here. Dominant most of the time belongs to the oncogenes in the cancer genes. And recessive most of the time belongs to the tumor suppressor genes. Somatic, you know the meaning. Germline, you know the meaning. Genetic targets. Just 1 point here. No. Tumor suppressor genes. Yeah. 1 point here. Do you know the telomere? Maybe Dr. Akrami have told you about the centromere, telomere, P, Q. Do you remember? A chromosome have some parts. It is chromosome. The short R means P. Long R, Q. It is centromere. Yeah, telomere, the end of the chromosomes. In the normal cell, when cell divide and divide, after a while, telomeres will be smaller and smaller. Okay? And for example, after 30 divisions or 40 divisions, the cell would be old and not suitable for dividing.
That cause we
Yeah.
get older.
Yeah, that cause we get older. Yeah, we have a Quran. In the Quran, we say. Do you remember the ayah which is related to the being old? Is there anyone that a hafiz of the Quran here? Yeah? No? You are in Karbala. I'm in Tehran. Yeah? There is the ayah in the Quran says, "Balamma balaga ashudda." Search and tell me the ayah. "Balamma balaga ashudda." body.
Just one part or one.
ومن نعمره ننكسه في الخلق. نعم. أين؟ ومن نعمره ننكسه في الخلق. It's just related to this part. After نعمره ننكسه في الخلق. After a while, the telomeres are deleted, are smaller. ننكسه. So it means in a normal cell, after some division, telomeres will be smaller and the cell should not divide. But if one cell do not miss the telomeres and the telomeres do not be smaller, the cell divide and divide and divide and they will make Saraton. Clear? Clear? You're so smart. You get the point. Here you see, in a normal cell, there are telomeres here at the end of the chromosome and they will be smaller, no telomeres here, cells stop dividing and senescence. Here, just listen to me please. Please. But in these cells, they are telomerase. Telomerase means they will add some parts to the telomere as you see here. And they will divide and divide and divide unproperly, unrespectfully to the limits of the cell, unrespectfully to the boundaries of the cell division. So cells keep dividing, immortality. What?
We control telomerase activity.
If we can control telomerase activity, maybe we can control cancer.
You have to mention all our aims.
Maybe we would be young at, for example, 108. If we can control the telomerase activity. The other question, what's the meaning of the immortality? Something that not have this. What's the meaning of immortality in the Arabic? Khulud. Khulud. Here, the path to cancer often starts with a mutation to a gene that produces growth factors. If the mutation results in producing too much growth factor, the gene may have become an oncogene, a cancer-causing gene. Cells with an oncogene became overstimulated to divide. You know the meaning of the proto-oncogene and oncogene, I'm sure. Not this slide. Okay. About this slide, just be with me. I have told your classmates that inshallah I will give you some sample questions. Okay. Just not tell the others that I have gave you. I know that they are say you are just taking a video of me, but maybe it's not good. I just want you, I will ask you of what I have expressed ta'bir in the class, not more. Or other than that, I will give you the sample questions. Clear? Don't worry about anything in my classes. Clear? So, here. When you see, what was the meaning of the epigenetic alteration? What is the meaning of the epigenetic alteration? Such as methylation. The sequence is same. Maybe it's good to just search it and you have a good experience of searching, I think.
رسول هات كده انت جنبك شوية
Epigenetics is a study of genes in gene expression, a study of changes in the gene expression that occur without altering the underlying DNA sequence. Clear? The DNA sequence is same, but expression is changes. What is the cause? Epigenetic. Clear? Back. DNA repair deficiency, large increase in unrepaired DNA damage, blah blah, DNA damage. made questions of them for you.
From here.
Here, just listen to me. Here. Have you heard about the retinoblastoma? Do you know the meaning of the retin? Retin. Do you know the eye?
Yeah.
We have a retin. Yeah. Retinoblastoma means cancer in the retin. Yeah. It's common in the child, in the children. Okay? The gene which is responsible for retinoblastoma named RB. Okay? RB is a tumor suppressor gene. As I should give you an example of the tumor suppressor genes, one tumor suppressor genes, just remember in your mind, RB. Clear? Tumor suppressor is the benzene or the brake? Brake. Thank you. Is it dominant or recessive?
Recessive.
You're so smart. Get the point just one time I have to tell you. Here. RB codes for the PRB protein, a master break of the cell cycle involved in retinoblastoma. Maybe I will ask you, what is the gene which is related to retinoblastoma? You will tell me RB. RB is oncogene or tumor suppressor. You will tell me tumor suppressor. Is it dominant or recessive? You will tell me recessive. Thank you. And maybe it will make in bone cancer in bone bladder and the small lung. Not important. Just this one. I want to give you one example of the oncogenes too. Which of them is good for you? Here, just listen to me. I want to remind the names of two genes which are oncogenes. Okay, just two. One of them is KRAS and one of them is CMYC. Just these two. These are oncogenes. Dominant or recessive oncogenes? Dominant. Thank you. KRAS involved in lung, ovarian, colon and pancreatic cancers. CMYC involved in leukemia, breast, stomach and lung cancer. Not important, just know that these are oncogenes. Okay? Clear? Just that. Here. Maybe someone asks you that what are the environmental agents associated with cancer? You will answer them very easily. Viruses, tobacco, radiation, chemicals, pollution, food are. What's your idea about the relation of the food and cancer? Please don't listen. Please. Okay? You are as my son. My son have 19 years old, somehow similar to you. Okay? So please. My question. What is the relation between the food and cancer? Is there any food that will make cancer?
Yes.
Such as?
Sugar.
Maybe, yes. Maybe effect of glucose will make cancer. Yes, a good idea. What about the food and cancer? Alcohol may make liver cancer. Yeah. So all of them are very important, are very easy. Classification by the most of the cancers are classified to belonging to their site of origin. Breast carcinoma of the ductal, blah, blah, not important. Just here. Remind your mind about the eye and retinoblastoma. Okay? Eye and retinoblastoma. Okay? Not good. Just this one. In this part, maybe there will be a question about the difference between the benign tumors and malignant tumors.
Benign can be cancerous.
Can't be metastasis.
Yeah.
Benign You are right. Benign tumor may make this.
But it's less dangerous.
May make. But the main difference between the benign and malignant is that benign cannot metastase, malignant can metastase. For example, a benign tumor in the brain can make this or not? Yeah, benign. Not go to other parts of our body. But because the brain is very important part of our body, the location is so important. A benign tumor may make.
Not in the brain, in other organs. We have a benign tumor. It's not metastasis. Why it can lead to death or something?
For example, other than brain, maybe in the pancreas. I just check it out again. Benign tumors are generally slow-growing and enclosed in the fibrous capsule. Although their location can make them serious, such a tumor located in the brain, are not considered cancerous, that is, they are not malignant, are given names that usually end in oma, although a melanoma is a malignant skin cancer. Cells of benign tumor resemble the cells from which they developed. These masses seldom metastasis, and once removed, they rarely recur. Just the main point. Benign tumors are better than malignant tumors. Okay, I know. Benign tumors cannot metastase. Malignant, metastase. Okay, but may some benign tumors lead to the death, such as benign tumors in brain. Again, so maybe I will ask you, are all benign tumors good for us? No. Which of them is bad? Brain. Clear? Malignant. Proliferate rapidly, invading neighboring tissues, can metastate. It's very important. Are named using the conventions of tissue, cell size, and origin. The cells of malignant tumors are relatively unstable, and this loss of structure and function is defined as anaplasia. Anaplasia belongs to the malignant tumors. Not important. This part one thing is important about the hyperplasia and hypertrophy. Do you know anything about the hypertrophy of the prostate? Do you see that your grandfathers have some difficulties in urination? They are going to the bathroom and they have some difficulties there. Yeah? It belongs to the hypertrophy of the prostate. The prostate is enlarged and the urination would be difficult for them. Are all hypertrophies cancerous or not? No. Hypertrophy means that the cells are growth, but not cancer. Just they are larger than the normal. Maybe they will lead to the cancer, but not all of them cancerous. Clear? So maybe your grandfather have hypertrophious prostate, but not cancer of the prostate. Clear? Very easy. Hyperplasia is an increase in the number of the cells. Maybe in the question, they will ask you about the difference between the hyperplasia and cancer. You say the hyperplasia is not a cancer. It's just increase in the number of the cells. Hyperplasia occurs in response to a stimulus and reverse when the stimulus is removed. It's good. Not bad, actually. Hypertrophy, which is an increase in the size of individual cells. Dysplasia is defined as an abnormal change in the size, shape, and organization of the cells. Hyperplasia and dysplasia may precede the appearance of cancer by several months or years. Maybe I will ask you just Question. Is it better to diagnose cancer early or late? Early. So, if you got a ball, you can diagnose early. If you take your father or grandfather to check PSA, you can early diagnose their prostate cancer, and it could be treated more easily. Clear? Cancer screening programs are designed to detect signs of cancer in people who haven't yet developed symptoms from cancer, lack of effective screening methods for some cancer, and inaccessibility of some anatomic sites further complicate the process. Other limitations of screening methods include false negative, false positive, overdiagnosis. Do you know the meaning of false positive and false negative?
Yes.
What is the meaning of false positive?
The checkup saying he have the disease, but it's not really.
For example, you take your father for checking PSA. PSA is high, but your father do not have prostate cancer. It is false positive. But maybe you take your father to the doctor and his PSA is low, but he is affected by prostate cancer. It is false negative. Tell me what is the difference between the false negative and false positive? I know that you didn't listen to me carefully. Yeah, you, yeah.
The PSA is high, and the person don't have prostate cancer, so it is false positive.
Okay, and what's the meaning of false negative? Okay, just a point. Here, not important. Here, just check this please. Here is the PSA, as I have told you. It is a prostate cancer marker. It tells them biomarkers or markers. Alama. Alama لسرطان. Okay? Biomarkers. Alama لسرطان. We have some other alama too. CA99, CA53, CA. From this alama, just
Prostate.
yeah, prostate is just remind in your mind this alama and this alama is good for you to review. For the men, PSA. For the women, CA 125. It's alama for ovarian cancer. Clear? These two just. Okay? Alama. Marker. Two more markers. Why? So
Just look him.
thank you. You saved me. My mom forgot to just warn me so tall to be accessible for me. It's the fault of my mom, not mine.
So
It's the fault of my mother and my father. Not my fault. It's their fault. Yeah, the genetic fault. My daughter is taller than me. It was good for me. It was. I'm honored of that. Okay. Here we have discussed about this. As we have discussed about the false positive and false negative, just this sentence, definitive treatment should not begin without a pathologic diagnosis. What is the meaning? Your father's PSA is high, but you should not treat him.
sure.
Yeah, you should be sure about the disorder. How you should be sure? You can take sample from the prostate and check if there is pathologic changes in the tissue or not. Clear? So, just this sentence. About the stage. When we treatment, the staging workup, the process is detected, blah, blah. Here, these are the characteristics, the alama for a stage. If the stage is high, it is good or bad? Bad. If the stage is low, it is good or bad? Good. The stage depends on some alama. First, T, size or direct extent of the primary tumor. N, big rub spread to regional lymph nodes. M, presence of distant metastasis. For example, if the size of the tumor is very small, it's good or bad? Good. The T is lower, the stage is lower, the treatment is better. Okay? If the tumor is large, the prostate is full of the tumor. So the T is higher, stage is higher, treatment is worse, not effective. Clear? Staging one, not important, not important. About the therapy. About the therapy. End of the slide. Just this slide. Then, okay? About the therapy. 4 primary modalities are employed in the approach to cancer treatment: surgery, radiation, chemotherapy, and biologic therapy. Do you know the meaning of the surgery?
Yes.
What is the meaning of the surgery in Arabic? Jaraha. Yeah. Jaraha is the best way for the tumor. Yeah. Because we remove the tumor. Yeah. After the Jaraha radiation, do you have radiation in your country? I'm sure that you have. In the Imam Hassan Hospital, you have radiation. Chemotherapy, you have in the Imam Hassan Hospital too. And Alvarez. Both of them, yeah. And what is the meaning of biologic therapies? Biologic therapies are the most novel ways of the treatment. In the biologic therapy, you check that there is a receptor on the cancer cell, and you will make the drug just attached to that receptor. It means targeted therapy. What is the meaning of targeted in Arabic? مستهدف. Yeah. مستهدف للسرطان. Yeah. So biologic therapy means that it is مستهدف للسرطان. Okay? Which of them is better? مستهدف للسرطان. Yeah. Because, for example, chemotherapy will destroy all of our body cells and tumor cells. But biologic therapy is مستهدف للسرطان, just the tumor cells. It's better. Clear? Surgery remains the treatment of choice. Surgery and radiation are local treatments. These modalities are likely to produce a cure in patients with truly localized disease. Systemic disease such as leukemia cannot be treated with a localized modality. Chemotherapy, including hormonal therapy, access the systemic circulation and can theoretically treat the primary tumor and any metastasis disease. Biologic therapies are currently considered in the broader sense of immunotherapy or mustahdaf therapies, targeted therapies. Maybe I will ask you, what is the similarity between, what is the best way of the treatment? You will tell me targeted therapy or biological therapies. Immunotherapy, the earliest important form of biologic therapy, usually involves stimulating the host immune system to fight the cancer. The other question, maybe I will ask you, is immunotherapy, for example, chemotherapy or radiation or targeted therapy? You will answer me, immunotherapy is targeted therapy. Okay? Immunotherapy means there is receptor here, antibody will attach just to that cell. It is immunotherapy, mustahdaf therapy. Clear? You got the point about the cancer. Actually, immunotherapy is one kind of biologic therapy. Clear? It's one part of it. And it means that they are targeted. They are just for the cancerous cells, not for the normal cells. We tell them cancer selected. chemotherapy and radiation therapy. Clear? Clear? Do you have any other question?
And biological therapy and immune is targeted.
Yeah, targeted. Actually, immunotherapy is one kind of the biological therapy. Clear? The other. Thank you for listening to me. We will have class, inshallah, 10 minutes or 15